Good morning and good afternoon, everyone, and welcome to this webinar on the potential of household surveys to measure women access to social protection. This webinar is organized in collaboration with socialprotection.org. My name is Afrah Al-Ahmadi. I'm a senior social protection specialist and the gender thematic lead at the World Bank Social Protection and Labor Practice based in Washington, D.C. It is my pleasure to be with you today and to moderate this session. The webinar will walk you through key findings from the World Bank discussion paper on unlocking the potential of household surveys to measure women access to social protection. The paper examines the differences in how women and men access social protection programs and how these differences relate to gender gaps in labor market outcomes. The session will also discuss the value of generating sex-disaggregated data for this type of analysis and to outline some practical steps countries can consider to adapt their household surveys in order to collect necessary data to inform policy and programming. This work builds on the World Bank STAAR initiative to strengthen data-driven dialogue and policy to advance gender equality. And the work is supported by Gates Foundation and the World Bank's partners and donors under the World Bank administered Rapid Social Response Multi-Donor Trust Fund. It is my pleasure now to introduce the speakers for today's session. We will first hear from Claudia Rodriguez-Alice, who will present the paper. Claudia is a senior social protection specialist at the World Bank. She's currently supporting the South Asia region. But before her current job, Claudia played a key role in global knowledge work, including contributing to the Aspire initiative and working on the 2025 State of Social Protection report. Claudia carries with her 15 years of experience and contributions to the Aspire data work. We will then have two discussants with us, Tabitha Bonfert. Anna will share some reflections on the paper. Anna is an economist in the World Bank Gender Group, and she leads work to strengthen gender data systems globally. And some of her work includes the Gender Data Portal, Country Gender Landscape Briefs, and Strengthening Gender Statistics Project across more than 12 client countries or partner countries. We will then hear from Rebecca Holmes. And Rebecca is she leads the Gender and Social Protection portfolio under FCDO's STAAR Technical Assistant Facility. She provides senior technical advice on gender transformative social protection. She's also a research associate with ODI's Gender Equality and Social Inclusion Program. So the agenda today is, after this overview, we will hear from our presenters, and then we will have the opportunity to open up the floor for questions and answers and hear from the participants. A few logistical points to bear in mind before we get started. First, that the session is recorded. The recording and the slides will be available on socialprotection.org and also will be emailed to people who registered to this webinar. Please use the chat box to introduce yourself, share comments, and add any useful links. As also, please take a note that Zoom AI generates automatic captions. And if you would like to see these captions, click on the CC button at the bottom of the screen. If you have questions, please post them in the Q&A box. Also, you'll find it at the bottom of the screen, or wait until we have the Q&A segment. And if you do so, please raise your hand. And when you intervene, very quickly introduce your name, your organization, and keep your question direct and short. So with that, I would be happy now to hand it over to Claudia to present, to start the discussion. Thank you so much. Over to you, Claudia.
Thank you, Afra. It's exciting to be here and present this work. As many of you know, it's well documented that social assistance programs, in particular, help enhance women's socioeconomic status, health, education, financial resilience, and contribute to the reduction of gender-based violence. However, there are still gaps to assess disparities in the access to social protection and determining its impact on mitigating differences in labor market participations in earning. What do I mean by that? There is plenty of literature, impacts evaluation on specific programs, and we know how these programs are benefiting women. However, there are no global, harmonized, country-level assessments of the access of women to social protection and how this compares to men. Next. Next slide. So what are the research questions we're trying to answer? So what we are trying to determine is how does access to SP programs vary between women and men? Do women receive higher or lower SP transfers amounts than men? Is there a sex difference in the aggregate country-wide SP transfer received? How does women participation in the labor market compare with the participation in social protection programs? How do women's average labor market earnings compare with the SP transfers they receive? And does social protection help mitigate gender gaps in the labor market? All these are the research questions that we were trying to answer, as I mentioned, at a global level, doing analysis for the country. Yeah, next, please. How do we do that? In order to analyze country level data, we use household surveys from 27 countries. These have been harmonized by the Atlas of Social Protection Indicators of Resilience and Equity, STAAR. How do we do this? So these are national representative household surveys. That means that ideally they collect enough information of the social protection system in each country. So what we do is to analyze all the social protection captured in the surveys, trying to create these three typology of programs: social insurance, social assistance, and labor market programs. For social insurance, we try to capture all the contributory programs that benefit particularly formal workers. For example, all the pensions and benefits for old age, survivors, and disability, maternity leave, and all other contributory programs. And by social assistance, we try to capture programs that are non-contributory, and among them we have cash transfers, public works, social pensions, school feeding, in-kind transfers and food transfers, fee waivers, and other social assistance that is assistance from the government that is not contributory. And then we have labor market programs. Under labor market, we try to capture unemployment insurance, training, labor intermediation, and any other program that helps individuals to access the labor market. So with these three categories of programs, we analyze the survey and aggregate the programs in these three variables. And these are the three variables we use for the whole analysis. Once we create and harmonize this data, and by harmonization, meaning that for the 27 countries, we created these three variables, right? Because we need like a harmonized unit of measure. And after we do this, we estimated the indicators, which is coverage, distribution of social protection recipients, and adequacy of benefits. What are these indicators exactly? So by coverage, we try to determine the percentage of women and men that are covered by any of these three types of social protection programs. And then by distribution of social protection recipients, we try to see among all the recipients of a program, the percentage of those who are women and men. And then by adequacy of benefits, we try to analyze the transfers as percentage of the household welfare, meaning their income or the consumption. In other words, how important is the transfer in the overall welfare of the household? All of this is disaggregated by sex, and it's novel data because in 12 years of expired existence, these indicators were generated for the total population, and this is the first year in which we launched sex disaggregated indicators precisely to do this type of work. With this analysis, these indicators, we calculate for the paper two indices. The first index measures gender inequalities in the provision of social protection benefits. So what we are trying to rank is other countries and see how progressive they are, meaning how much they cover women with respect to men. And then in the second index, we measure the net earnings received by men and women from both labor and social protection and try to quantify is the amount of benefits helps assess the labor market gaps in earnings. Okay, so I'm going to explain this throughout the presentation, so no worry if it sounds very heavy at the beginning. Okay, next slide, please. Next. So what I'm going to present now is the results of the paper after doing the analysis I described. First, this slide gives us some context. What is the gender gap in the labor market? So we analyze two indicators. One is labor force participation, which is the figure on the left. So what we are trying to show here, we have a graph in which we basically compare the labor force participation percentage of male and female, and we estimated a ratio dividing the labor force participation of women divided by the labor force participation of men. What this does is normalize the participation of men at 100%, and then you see what's the percentage of women's labor force participation compared to men. So if it's below 100, then there is a gap, right? If it's above 100, then women participate more at a higher rate than men in the labor market. But as you can see here, if you see the line at 100%, all the bars, that means women's participation ratio are lower than 100%. That means that for all countries, the 27 countries analyzed, there is a labor force participation gap. And this is not a surprise. This is universal, basically, in any country, beyond these 27. So the gray lines is the gap in gender parity, which is basically the distance between the bar and the 100%. So in conclusion, for our 27 countries, we determined that women's labor force participation is 31% lower than that of men across the samples, on average. So conclusion, yeah, there is gender gap for every single country, basically, in terms of labor force participation. Now, if we see the figure on the right is exactly the same. If we see the gender parity in terms of monthly earnings, do women basically earn more money than men in the labor market? No. You can see every single country, men, actually there are two countries, men in most countries make more money than women, except for Ecuador and Panama in this chart. You see the green lines for these countries are above 100%. These are the only two countries that there is no gender. I mean, the parity is biased against men because women make more money from the labor market than men. But in general, for every dollar earned by men, women make on average only 85 cents. So this set the stage, right? There is a gender gap in the labor market. Now, how does social protection benefits help address this gap? That's the question we want to answer in this paper. Next, please. Okay. So this chart has the same logic that the previous one, except that we are graphing the 100% line for men level at, it's the red line that you see here. This chart represents coverage, the percentage of women and men that benefit from social protection. And once again, it has been normalized, dividing the coverage of women by coverage of men to establish the male level at 100%. So that means that everything below 100 means that women are covering a less, in a less percentage than men. And if it is above 100, then women participate at a higher rate. So what you can see here is that in most countries, at least 19 out of the 27 for social assistance, women participate at a higher rate. So that means there are more women receiving social protection, in particularly social assistance programs, than men. This is not a surprise because many social assistance programs are targeted to women, right? We have social assistance programs that are targeting pregnant women or women with children or widow or destitute women, or now there are more programs trying to incentivize women to participate in the labor market. So there are, more what we call productive inclusion programs targeted to women to help them precisely to access the labor market. In this sense, it's not surprising that these lines for women, in social assistance, the orange lines are about 100%. Well, it was a surprise to me is to see for social insurance, there is also a lot of countries that show more women receiving social insurance programs. And this was a personal bias of mine because, I believe men, because social insurance reflect the labor market participation, if there are more men working than women, as we saw that the labor market participation rate was higher for men, that means there are more men contributing to social pensions to contributory pensions, and that means that there might be more pensioners or more men receiving contributory benefits of any kind. But actually, it's not necessarily true. So women also receive a lot of contributory benefits, and this is due to two reasons. First, women tend to outlive men. So, men die first at at a younger age. That means, pensioners are dying, male pensioners might be dying faster than female pensioners. And when they die, their spouses, receive a survivor's pension. So there are like two ways in which we can explain that there is a high participation of women also in social insurance. And these are reflected in the blue lines. It's not for every country, but for a lot of countries, you see this. We were not able to analyze labor market programs because there wasn't enough data in the survey, so we focus only on social assistance and social insurance. So on average, overall, we can say that 1.2 women receive a social protection transfer for every man across the 27 countries. So social protection in terms of women's participation is biased towards women because they are covered at a higher rate than men. Next, please. This slide is the distribution of beneficiaries. Just to also confirm the previous point, this is basically analyzing among the total beneficiaries, what's the percentage who are male and the percentage who are females. And we see that for more than 50% of the countries in the sample, no, in two-thirds, sorry, in two-thirds of the countries in the sample, women comprise more than 50% of program beneficiaries. So we confirm that among program beneficiaries, women represent a higher, percentage. Next, please. This is the average per capita transfer. So we basically analyze the amount of the transfer received by women and men and see if there is a gap, right? Who receives more, a higher value of transfer, women or men? And that's when we see the difference. If you see just a few bars are above the 100% level, that means that women receive less value transfers than men in social insurance mostly, but also in some social assistance programs. This is not surprising because this really reflects the gap that you have in the labor market when workers contribute to social insurance. If men receive a higher salary, they contribute higher, at a higher rate, higher contributions, and also for a longer time, and their pensions might be higher than the pensions received by women. That means this is the opposite picture of coverage, right? In terms of average per capita transfer, where we see across the 27 countries that on average for every $1 received by men, women only receive 81 cents across actually we have only 25 countries because 2 were dropped because they didn't have information on the monetary value of the transfer. So we could only use 25. And across these 25, we see there is a gap in the social protection transfer received by women. Next, please. So now we are getting into the estimation of the indexes. And bear with me, this formula is just to help understand what we're trying to calculate. We are trying to calculate the overall monetary value of earnings from work and earnings from social protection. So what we do is to multiply the labor market participation rate of women and men by the monthly earnings and calculate a ratio. So we have the aggregate labor market earnings in terms of female to male ratio. And then for social protection, we do the same. We multiply the average per capita transfer times the percentage of coverage to see the countrywide volume of transfers received by women and men. And we calculate the ratio, and that gives us the first index. Next, please. So you can see this table. The first one, we have column A are the countries, column B is the female to male ratio of aggregate market earnings. That means when we multiply labor force participation times earnings, we get the ratio in which the female to male ratio, you see everything in column B is below 100%. So that just confirmed that there is a gap in terms of labor market participation and earnings in the labor market. So that's not news. We knew already that. But what is novel is column C, that we do the same in terms of social protection. After multiplying the average per capita transfer of all beneficiaries in the country times the coverage rate, we get the volume of social protection transfers received and calculate the female to male ratio. And you see that many, about half, are above 100%. That means that those countries, the value of transfers received are higher for women than for men at a country level, right? This is the aggregate. So we try to rank in terms of what we're calling progressivity in supporting women. So we have two countries at the bottom that are reporting, ratios below 50%, and we are calling those regressive. That means, the value of transfers received by women is really, really low. It's less than 0.5% of what men receive. And then we have the mildly regressive, which is above 50, but it's still below 100%. That means in these countries, the value of social protection transfers for men is still higher than women. Then progressive are these countries, from Mongolia to Serbia, if you see the column A, in which the value of social protection transfers received by women are higher. And we call strongly progressive the three top countries, Kazakhstan, Georgia, and Tunisia, that are providing a value of transfers at a higher rate, more than 1.5, ratio than men. So this is how we determine, how biased towards men or women social assistance systems, social protection system are in these countries. Next. So the second index, we're trying to see how then if you compare these two ratios, right, the value of earnings received from the labor market and the value of earnings received from social protection, you have these two basically aggregate monetary values from work and from assistance from government. And you determine these aggregate earnings from both, the combined earnings, and compare it to what women receive in terms of men. So we calculate the ratio again and see if men are receiving more money basically from both sources, from labor and social protection, than women, if that makes sense. Let's see the next chart. It might show what the results are on this. Okay, so in this one, because what we are estimating is a ratio, you see the red line at 100%, that's the male level. And you see most of the bars are below. The bars are the women's level, right? So what we are trying to pay attention to is the net effect, which is when we compare the earnings from labor and earnings from social assistance by women and men, and this is all weighted. What happens is, because the gap is so large in the labor market, social assistance helps address this gap. Women might receive more money from social assistance, but it's not enough to close the gap. So the conclusion is that even though social protection systems address or help reduce this earning gap that, from the labor market, it's still not enough to close that gap. It's still, the women are not receiving enough value of transfers to close the gap of the money they don't receive from labor, basically. So that's the conclusion. Next. Next slide, please. So if anything that no, previous slide, thank you. This is what you need to remember from all what I have been explaining to you now. In the sample of 27 countries, our analysis finds that while women on average receive social protection benefits, they receive social protection benefits at a higher rate than men. But the transfer amounts they receive are generally lower. So they participate at a higher rate, but the amounts they are receiving are still lower than the amount received by men. And this discrepancy is explained largely by contributory old age pensions, because pensions tend to be higher for men due to the gender gaps in the labor force participation and accumulated contributions. So, men still contribute more money than their pensions are higher, and that creates a gap also in social protection. For this reason, even though social protection plays a significant role in mitigating the gap in labor market earnings in these countries, it did not fully close the gender gap in take-home income. This tells us that it's more work to do, right, for social protection practitioners. Social protection measures need to reduce gender inequality, and this can be significantly enhanced by carefully considering the program mix, the design features, the program scale, and the transfer levels. Next. Next, please. Now, there is an agenda in terms of the data need for this analysis. This, in reality, was a proof of concept, something like we need good data to do it. Once we issued the paper, many countries contacted us and said, why are you putting us as a regressive, country bias against women? Because we have all these social protection programs now that are targeted to women, that are targeted to mothers. So that's not reflecting our reality. And I said, yes, exactly. That's the point. Your new program targeting women is not captured by the survey. So if it's not captured by the survey, we cannot analyze and we cannot reflect that new reality that your country, is doing now, addressing the gap in social protection for women. So it is important to have good data to do accurate analysis. Next. So why, for example, I want to explain to you why we only have 27 countries for the sample. We actually started with 21 surveys that collected social protection information. And out of, for this analysis, we needed to know the individual who receives the transfer. So that means the survey needs to capture that information at the individual level. And only 27 countries had all the variables captured at the individual level, all the social protection variables. That's the yellow section. And then the blue section, there was a mix. Some programs were at the individual level, some at the household level. That means we couldn't capture the whole complexity of social protection and we couldn't use it. And then the orange means that those variables were captured at the household level, so we couldn't use it at all. And that's why we ended up with a 27 country sample. Next, and this is the last slide. I know I'm out of time. So this analysis, anything is flagging that we need good data to do this type of analysis. This is, as I mentioned, a proof of concept. And the idea is to have good data to escalate to more countries, right? As more surveys start capturing data at the individual level and capturing monetary variables, because if we don't have the information of the transfer amount, we cannot calculate average per capita transfer. So there is no index to calculate. So this is a call for action for national statistical offices and governments to please improve the social protection representation in the survey to start with. Many of the countries you saw appear regressive because the survey didn't capture social assistance programs, which are the ones who are usually targeted to women, but only capture social insurance programs. That was, then that's why they were not reflecting a good, progressivity towards women. So the first step is to have good representation of programs in the survey, collect the data at the individual level, and collect monetary values for each program. If we have this combination of information available in the survey, then we can revise this analysis and scale it up. And that's what we would like to do in the future. And with this, I leave the floor to our fellow discussants to take over and on this topic of this analysis. Thank you.
Thank you so much, Claudia, and thank you for staying on time. Message is very clear from your presentation, and that is it's very important to have nationally, at the national level, sex-disaggregated data. That's very important to understand the performance of different instruments or different programs in the space of social protection. And with understanding that performance, then countries could really leverage the power of social protection instruments to address the gender inequality. So let me invite now Anna. Anna, if you could share with us some of your reflections on this analytical work, and maybe zoom a little bit your reflections on how do you see this analytical work links with the World Bank Group's commitment on gender inequality as reflected in the gender strategy, as well as the corporate target on social protection, coverage of women in social protection programs, and also how you see this work links with the data work that you're also leading. Over to you, Lana.
Thank you so much, Afrah, and really, I'm really happy to be here today to offer a few reflections on what we just heard from Claudia. I think this was a very rich discussion, so and a very timely paper. So really excited. Next slide, please. Thank you. So recently, we really hit a couple of organizational milestones here at the World Bank that put gender and social protection and data on the map, right? So Afra, you already mentioned our gender strategy that's now in full implementation. And this strategy is all about transformative action and ensuring accountability for results. And part of how we do that are these newly defined gender strategy targets. And we have several ones, but one of them is a target to scale up social protection programs. So working alongside our partners, we aim to support at least 500 million people in developing countries by 2030. So really only a few years left to accomplish this goal. And half of these people, so 250 million, will be women and girls. Now, this I'll briefly reflect on this, right? Because it really represents a fundamentally new approach of how we're doing things, right? We're looking for the first time at the number of beneficiaries. So not inputs, not outputs, but really the number of people that are actually benefiting from our programs. And then we're also being very transparent about monitoring these targets. So we are using our new corporate scorecard that everyone can access, and everyone can go on the external website and check where we stand. So really adding that accountability for an external audience as well. What these targets do in addition is they really also add a qualitative shift, because they encourage our task teams to integrate gender transformative interventions and approaches. And what we mean by this is, looking beyond just the numbers, but also trying to tackle the root causes of gender inequality. So in the case of social protection, this may mean, for example, to layer a social protection program with additional support in terms of economic inclusion. And the idea in general behind these targets, so not only the social protection target, but also the other ones that we have on access to capital and on digital inclusion, is really to influence our strategic programming and to drive the discussions and client engagement. Now, for social protection specifically, right, I think you would agree that this is a very ambitious target, right? I mean, that's 250 million people, women and girls. So we really are scaling up our efforts, and by doing that, we focus on where countries are in building their social protection system. So in some cases, this will mean really focusing on the foundations and building the basic structure of systems. In others, it will mean to scale digital delivery And wherever possible, of course, we'll focus on these gender transformative approaches that I mentioned earlier. So delivering on this target will require a combination of not only increased financing and strong implementation, but also really working with countries to improve the social protection delivery systems. And this is where the data comes in, right? So sex disaggregated data in social protection is really, really critical to design effective, efficient delivery systems and mechanisms and to inform country priorities. And I think Claudia already presented a few potential use cases, and I'll provide a little bit more detail on additional applications. So all of this to say that the Aspire database is really a valuable tool to inform sector analytics and country social protection priorities. So when Claudia first reached out to me about 2 years ago with the first draft of this paper, there was really no way of knowing how well timed this publication would be. So next slide, please. Okay, so how can the indices presented in Claudia's paper be used in policy design? I think they're really powerful tools. I mean, I just summarized here in these 3 bullets again what they enable what they enable us to see. So they help us quantify gender gaps in coverage in the social protection transfer, so the actual value of the transfer, and then directly measure the progressivity of social protection systems and the net impact on reducing income inequalities between men and women. Now, what really is the value added, right, of these indices is that they can provide, right, contingent on data availability, a bird's eye view of how the entire social protection system is faring in terms of gender equality outcomes. So not a single program in isolation, but really looking at the system as a whole. And this is often, you know, this can be very useful because you will need to have the different pieces all coming together when you want to understand how your country is faring. So now thinking about a couple of potential use cases, right? So the first one is obviously diagnostic and benchmarking, right? So if you have an index, a country can like at a glance see how, you know, their social protection spending is either neutral, regressive, or progressive. And as Claudia has mentioned, I mean, some countries have already reached out, right? Because they absorb this information, they see this information, and it's valuable to them. So for policymakers, this is useful because as more data becomes available, they could track their performance over time. They can compare with peer countries, and then they can also set measurable targets for improvement in terms of gender equity and social protection. So say if you find out that all of your social protection spending combined is quite regressive when it comes to gender equality, right? You might, you know, this might spark a policy discussion in a country on how you could change that. Now, then we could come into the second use case, which is essentially program design. So what do you do actually about changing the gender equality outcomes as reflected in these indices? And here you can use this data to inform program targeting and resource allocation. So I think evidence from the indices can help justify directing resources to certain programs or scaling up interventions that will be most effective in closing gender gaps. And then also thinking about a more equitable distribution of program budgets between social assistance and social insurance. So kind of striking that balance and embedding corrective measures in contributory schemes. And then a third case would be on accountability and advocacy. So I think what is really neat about these indices is that they provide a very clear standardized metric. So not only, you know, is that data comparable but it's also easily it's easy to interpret it, right? So this can help civil society, researchers, other international organizations to use this information to hold governments accountable for progress on gender equality goals within the social protection sector. And I think it's also an opportunity to identify, countries that are, that have highly progressive social protection systems and learn from their experience. What are they doing, that works towards improving outcomes. So I think overall, the contributions of this paper are really excellent and really can help add more visibility to how the system overall is faring. Next slide. Okay, so now that we have established that this data is both incredibly useful for policymakers and also very important to meet the ambition of our very own gender strategy, I guess the question is how can this work be scaled up, right? And Claudia said that this analysis is based on only 27 countries, which I mean goes to show, right, that there's a missed opportunity here, right? There were a lot of surveys within that same time frame between 2016 and 2022 that could not be considered for this analysis because they did not collect all the social protection information at the individual level. So I think moving forward, we as a community of social protection practitioners and data experts, we really need to push for more countries to include the relevant modules and questions in their survey design. And I won't go into detail on all these recommendations that Claudia presented already, but it's pretty straightforward what needs to be done, right? So really ensuring that all major SP programs are covered, that the data is collected at the individual level, and then critically also to include the exact transfer value that was received by the recipient. Now thinking about how we can make sure that more countries adopt these recommendations. And I think here there's a big opportunity to leverage the World Bank's ongoing engagement with national statistics offices. So on the one hand, right, we have our investments in national statistical systems through statistical capacity building projects, and they have a mandate, right, to help countries build the capacity to generate relevant gender data for all sectors, so including social protection. And then on top of this, right now we have a project that's called Strengthening Gender Statistics. Afrah had already mentioned it in the opening. But basically, our team is working with 12 partner countries and a lot of additional non-partner countries on increasing the availability and quality of gender statistics. And in this phase, so in the last few years, we've really focused on employment data, on entrepreneurship and asset data. But this work, is really something that could be scaled up and where social protection, as a focus area could be included as well. So really leveraging the approach that we developed on streamlined technical assistance that spans the survey design, indicator calculation, and data dissemination, and applying and supporting countries in adopting international best practices regarding social protection data. Then the second question, I think, is how we can get the most use of the data that already exists, right? Because that's really critical. I mean, if there's only a few countries with the data, at least we need to make sure we can make the most out of it. So in there, we can leverage our existing dissemination channels. So we have the Aspire database, which is a really great tool. I also encourage you to visit the gender data portal that contextualizes some of these findings and also links to the Aspire database. And then it's really important at the country level, right, to focus on facilitating these evidence to policy processes. So just because the data is available and it's there doesn't mean that it's going to be used. So what we've seen in the Strengthening Gender Statistics project is that there's really this support. It's really critical to provide the support to governments in translating the data into actual insights, right? And that can happen in many ways. So in policy briefs, policy discussions, dashboards, participatory data reviews. So really trying to go from the analysis then to design and implementation. So I'll stop here. Congratulations again to Claudia and the team on this excellent work, and thank you, and happy to answer any questions. Thank you.
All right, thank you so much, Anna, and thanks for apologize for that. Thank you, Anna. Yeah, and thanks for expanding on the additional data work that the bank is involved in. But the bank is not the only organization that's also paying attention to the data. I know some other development partners are also, and STAAR has been active also on the data. So with this, I'm going to turn to Rebecca to also share her reflections, but also maybe in your reflections, Rebecca, to touch on how do you see this work, whether what Claudia presented or what Anna spoke to, how could it really contribute to the ambitions of development partners who are engaged in the gender equality agenda, with the ambition of data harmonization, which we know it's very challenging when we look at across agencies. So it'd be good in your reflections if you could also touch on that. Over to you, Rebecca.
Great, thank you so much, Afrah. And again, congratulations to Claudia and the team for such a great paper. I mean, it's really rich with many contributions to the broader gender responsive social protection sector. If we go to the next slide, I just wanted to highlight sort of out of the number of contributions, two which particularly stood out to me, and taking a step back and thinking about the broader the broader social protection sector. And really the first key contribution is that this paper really reflects a growing momentum and effort by other agencies as well, but including the World Bank, in expanding disaggregated data systems related to social protection for informed decision making. And I think really this can't be underestimated in terms of how far research on gender and social protection has come over the last decade or so, especially in terms of documenting social protection outcomes from a gender perspective. And I think, we also can't take this for granted, especially in our current political and social context that we find ourselves in. And we really know that the importance of this data is critical for understanding the gender gaps in social protection coverage and adequacy, as your paper, Claudia, really highlights, and which helps us make the case for the expansion, for the reallocation of resources to forward and to promote a more gender responsive social protection system, which is often invisible when we don't have this kind of global or countrywide data. We also know that this better data can help us understand the impacts of policies and programmes on gender equality, poverty and resilience, and the linkages between them and these outcomes more broadly. I think the second key contribution is that this study emphasises the importance and the value of collecting and analysing data beyond contributory social protection, as well as also beyond just coverage. And, Claudia and Anna have both spoken to this point in terms of the importance of understanding both. But I think this also does reflect some progress that's been made in expanding social assistance over the last decade or so, but also a shift in understanding on gender responsive social protection, which has moved or is still moving from understanding gender and social protection as only addressing gender inequality because it program targets or reaches X number of women, to really recognizing and understanding that gender inequalities have to be addressed across the social protection system, from design to implementation, so including adequacy and types of benefits, not just coverage. And these 2 points are really important in terms of situating this contribution of the paper in the broader research and evidence agenda of gender responsive social protection. And I just wanted to highlight a few key issues that came out in a research workshop that STAAR hosted last May, which took stock of gender responsive and inclusive social protection research and aimed to identify future research areas. Across the key researchers who were represented there was a general agreement that a strong evidence base has been built over the last decade on gender responsive social protection, using quantitative, qualitative and mixed methods research, but largely at kind of program level rather than countrywide or global levels. But this has been really important evidence in demonstrating that well-designed and implemented social protection can close gender gaps and can support gender equality outcomes. And we especially have good evidence around health, education, economic empowerment, certain dimensions of well-being, as well as social protection contribution to the reduction of gender-based violence. So really important outcomes relating to gender equality and women's and girls' outcomes. But participants also from this research workshop also identified a number of key gaps. And I'm just going to focus on a couple of those here because one of these key gaps related to understanding the risks of new global challenges that can have a strong influence on social protection design and delivery, including its potential for gender equitable and inclusive and transformative impacts. And these trends are affecting, everyday life in many countries, such as climate change, displacement, and the increasing rise of fragility and long-term protracted crises. The second issue, which will be very familiar to gender equality advocates, is really understanding how social protection affects, but is also affected by long-standing gender equality issues, such as persistent discriminatory social and gender norms, the care economy, the role of community-based and civil society organisations, and looking across the system, including the social service workforce. And within this discussion, three sort of important methodological considerations emerged as necessary to inform future research and evidence. One of those was around longitudinal research, important to shed more light on the effects of social protection over the life course and to pick up on intergenerational and intersectional issues and changes that occur over time, particularly in response to economic, climate and crises events that we know can disrupt trajectories. And we also know that social protection programmes have a role to mitigate these impacts. We also know that we can't design effective programmes and systems unless we understand how different vulnerabilities combine and compound over time, as well as how social protection can mitigate those impacts. The second area was around supporting multidisciplinary and mixed methods research to offer valuable insights and a more comprehensive and detailed understanding of situations, including the role of gender and social norms in influencing programme design, implementation and outcomes. And a desire to have more innovative research methods that combine relevant data sets to shed light on how different factors impact social protection to reduce poverty and vulnerability, such as combining climate or poverty or social protection delivery data to understand how these relate. So sort of out of this wish list, or despite this potential that there is for strengthening gender data, we know that there are a number of challenges to improving data on gender and social protection. And some of these challenges have already been highlighted by you, Claudia, and Anna. But let me just highlight a few. And this is drawn from a recent publication by STAAR, which was written by Tia Palermo and Maya Gavrilovic, at the request of the SPIAC-B Gender Working Group, which is the Social Protection Interagency Cooperation Board Gender Working Group. And they conducted a rapid mapping exercise aimed at understanding current efforts of global development agencies. So they looked at UNICEF, the World Bank, and ILO in collecting and analysing and using disaggregated data in social protection systems. But really just sort of highlighting some of the key gaps and challenges that the paper identified, and which you've reflected on some of these as well. So we know that there is still a narrow focus for data collection on social protection, especially where social assistance schemes are diverse or perhaps small scale or pilot, or are not sort of embedded in legal frameworks. And data management is fragmented, and this really limits, as you said in your presentation, Claudia, the way that social protection programs can be picked up by household surveys, for example. The other one is around data being still collected at the household level, and also analysis gaps, because analysis by gender and other intersecting inequalities can be time consuming. There might be data, but it's underutilized, or there might not be demand to disaggregate. So it was really interesting to hear that your paper has also created some of this demand in the policy space, which is really important. And another couple of challenges in terms of disconnect between agencies and limited coordination across countries and regions. So a lack of consensus, for example, on harmonisation and coordination, and then limited investment into building long-term data systems, which is still a challenge. So just on to the next slide, two kind of key main solutions or ways to improve these challenges have been identified. And one is around strengthening the national capacity for disaggregated data collection and analysis. For example, building on trainings that are already being conducted with national statistics offices to support gender disaggregated social protection data collection and analysis, and supporting training and advocacy on the importance of this, as well as leveraging single and social registries to provide information. And then the second area is around promoting harmonisation and cooperation across agencies to strengthen disaggregated data collection and analysis, and a recognition that, you know, harmonisation of data is challenging, but it can happen progressively, partly through developing universal definitions of key gender equality indicators to measure in social protection programmes, and also the continued support in terms of advocacy and awareness raising, and leveraging existing sort of opportunities, including, for instance, the SDGs and global targets, to facilitate improved and coordinated monitoring. I'll stop there, but thanks again, and congratulations for such an important research product.
Thank you so much, Rebecca, and a huge thank you for all three speakers. So we can open up now for question and answers or reflections from the participants. I don't see any questions posted on the Q&A. So please feel free to raise your hand if you would like to speak, or you still have the chance to write your question on the Q&A box. Oh. I'm having some technical issue here. Okay, so I am trying again to check if anyone is raising their hand. So maybe while waiting for people to think of questions, maybe I would start asking you, Claudia, to sort of a few thoughts in terms of what you think is next on this agenda. Sort of in terms of how countries that have been already, the 27 countries, could benefit really from the analytical work of their data, but also what sort of could incentivize other countries to join forces on collecting sex-disaggregated data. And what's next for the ASPIRE program?
Thank you, Afrah. Yeah, I believe the paper shows the potential, the kind of analysis that can be generated with this data and actually inform policy, social protection policy, as Anna and Rebecca pointed out. As I mentioned, several country teams contacted us with questions about how they can improve like the reflection, because they thought they were not being reflected accurately, given that they have been already implementing program towards women. And for me, that's the first step, right? The countries themselves have identified the need to have this data on what they are already doing now, scaling up social protection programs for women and how to start collecting data on them. So they themselves identify the need to reflect this, not only in household survey data, but also in administrative data. I mean, the paper doesn't use administrative data for the indices, but is as important as household survey, right? So I think what Anna and Rebecca mentioned really resonates. That first, we need to help countries to get there. So, work on capacity building, showing the value, like this type of analysis, showing the value of what they can potentially do with the data and how they can, more importantly, how can they use it to actually inform policymakers, inform, government institutions implementing these programs. I think that's the first need. And the other one is, there are several initiatives on how to improve, gender disaggregated indicators among all the development partners. And I think coordination is important. Agreement on what data should be generated and how we harmonize it. So all, our work creates synergies, and instead of maybe duplication or parallel branches of work, we can come together and coordinate to help countries to achieve this potential of generating the data. I think that's the immediate step, like capacity building and coordination and having a north of where we want to get in terms of data. And that should create a synergy, a feedback loop with programs implementers of, what they are already doing on the ground, how can be captured, how we can analyze it to feed them back with analysis. I think that's what comes to mind.
Thank you, Claudia. We have a question on the Q&A box from Juliet Sibon. And the question is, to what extent can the World Bank require country teams to collect and support gender disaggregated data? Maybe I'll ask you, Anna, to reflect on this, sort of in the context of the gender strategy and the work with the country partnership frameworks and onward. Over to you.
Thanks, Afrah. Yeah, this is a very good question. I mean, especially as we're talking about, how can we create incentives, right? So I know that from our experience with the Strengthening Gender Statistics Project, there have definitely been cases where partner countries, had basically a requirement to make more gender data available, part of the results framework, right? So for example, in Benin, a disbursement of project money was tied to publication of a gender fact book. So this was not for social protection data specifically, but more broadly. And then also, in order to get gender tagged, a lot of the operations on statistical capacity strengthening, they need to have, or there is an indicator that's tracking the availability of gender indicators in the country. So, and these are indicators from the UN set of minimum gender statistics. So it's basically encouraging the country over the project cycle to expand the availability of indicators from that list. Now, for social protection projects, I think this would be more a question to you, Afrah and Claudia, but I mean, on the statistical capacity operation side, it's definitely something that we're already encouraging, and that is being done. Thank you.
Yeah, maybe Claudia could add, but I think just an additional point from my side is that with our new corporate strategies, there is a requirement actually that across the indicators that now teams are required to collect gender disaggregated data or sex disaggregated data. So that's just another sort of tool, but that's for the bank to understand and for our client also to understand how the bank financing sort of also address the gaps. I don't see any other questions or hands raised. Please don't be shy. If you would like to speak, just raise your hand and come in. Maybe one more question while we wait to see if another question, since we have little time. Rebecca, I think one of the big challenges is that when in specific countries and we have multiple partners sort of active and operating, and the issue that you also highlighted in your presentation as one of the entry points is harmonizing data, whether it is across sectors within the country, but also across development partners, especially in low income countries where you have multiple partners sort of engaged. What do you think, what are, sort of a few thoughts from your research and also from your experience in terms of what would really move the needle in terms of pushing the harmonization on the data front? Because a lot of times we see countries scattered between too many programs, too many results frameworks, too many indicators floating across these programs. So what would really incentivize harmonization, whether it is within a country across sectors or across partners?
Thanks, Afrah. I think that's a really difficult question and one that we've been grappling with for a while, both at sort of the global level as well as the country level. I mean, I think, at the global level, partly, a few years ago when the STAAR Gender Working Group commissioned the mapping that I presented very briefly, that was really a way to try and understand where those sort of entry points are, as well as identifying those gaps. And I think at the global level, the STAAR Gender Working Group is a really good vehicle for making those connections and for having a sort of a work stream to focus on that at the global level. And I think, we have also seen a lot of movement in the last few years, especially, I mean, with the World Bank, with your work, but also the ILO World Social Protection Report and the analysis that has come from that in terms of the gender disaggregated data has been really good. UN Women, UNICEF, the big agencies are all sort of really contributing. So I think there's a really good opportunity at this point and moment in time as well to reconnect on that at a global level. And then at a national sort of a country focus level, I think one of the key issues is exactly sort of that disparate nature in a lot of countries in the way that social protection is fragmented. But I think it does take somebody to take the lead and to start, a discussion in country. For example, with development partners, you can use the social protection coordination group or social protection task force, whatever it is in country, as a way to spearhead that discussion and start looking at what different agencies, what the government is collecting and mapping at a country level where those sort of synergies, but where those gaps also exist, including even on definitions of social protection or the types of indicators that are being collected by different organizations. And I think that would be a really good first step to start that sort of harmonization agenda, recognizing that it is tricky, but I think there are some really practical ways that it could be supported.
Thank you, Rebecca. I think these are really excellent points. Yeah, especially on the building on existing platforms. Oops. Yeah.
Sorry, can I add?
Yeah, please go ahead.
What Rebecca said. It's also important to remember that for all this work, funding is important, right? Because even the analysis that we were able to carry on with the STAAR database, just harmonizing hundreds of files in terms of sex disaggregating the data is time and, human resource. And for countries to improve household surveys, they might add additional modules for social protection, translating the questions into collecting individual level granular data is costly for national statistical offices. And that's how we also need to help as partners and donors, foundations to have this in mind, right? It's not just a matter of requesting when two countries need to produce this data, but help them and also look for the resources that they are needed to do it, because it's time and it's costly, especially for household surveys. With that being said, I think in terms of admin data, there is a big opportunity with more countries moving to have centralized social registries, because they are collecting already data by sex that can be used, right? If we help them harmonize and have methodologies in which they can anonymize the data and use it for analysis, I think there is already great potential that this is happening, in terms of social registries. Over to you.
Yeah, indeed, Claudia. I mean, I saw it firsthand in some countries where a discussion with the statistics office on expanding sort of on the data for the surveys. And then at the end of the day, it's capacity is one, getting technical assistance and how best to capture data is another, but also as important and challenging for client countries and partner countries is the funding, because every question means extra financing. So yeah, it's a really very important point that the also looking into the financial implication of this is very important. I still don't see any questions or hands raised. So any of the other speakers would like to have any final words before we close the session, unless we get some of the participants to raise their hand.
Maybe if I can come in just reflecting right on what we heard in terms of building capacity and convincing NSOs of the need to add these modules, right? I think we also discussed this importance of the interministerial coordination, right? So making sure, right, that all the information on the social protection program flows to the NSOs for inclusion, right? And having that dialogue on why it matters and why you need to include the transfer value and all of this. So I think this is information, I mean, and then this takes time and effort, right? I mean, it does not happen automatically, right? And same if we think about integration of survey data with admin data. I mean, this is not this requires a lot of thoughtful thinking and cross triangulation, and it's really not automatic. So really really an important area to pursue in the future.
Thank you, Anna. I am still wanting to give a few seconds chance for any of the participants if they would like to come in with a question. Okay, we have gained a little bit of some minutes. I'm sure all of us could use. So I would like to thank all the speakers, the participants, but also thank socialprotection.org for providing this platform. So thank you so much, everyone. As we said earlier, the recording and the material will be shared with those who registered by email, but also is available on the socialprotection.org website. So thank you, everyone, and have a wonderful rest of your day.
Thank you very much.
Thank you.
Bye-bye.